from Pakistan.
Mama.
Yes, Mama.
I can't help it.
I am also a mama
I'm
of
a
a 2-year-old and I have an 8-year-old stepson.
Yeah, I'm a king pimp.
Thank you. I grew up in the Midwest, and I got my master's in forensic psychology, and then I pursued my doctorate in clinical forensic psychology. I kind of see everything under the sun, and
Mama, with carrot.
sweetheart, we'll eat carrots in a little bit.
Yeah, okay.
But my niche is child and adolescent trauma, developmental disorders, but I see everything under the sun. Coming from a forensic perspective, I work within the judicial system as well. So I've had that experience as well. And substance abuse and trauma has been rampant given the last year and a half. I reside in Chicago and been within the field for the last 12 years. Mama? Can I see your carrot? It's beautiful. Thank you. At the end, if anybody has or needs to contact me, I run a private practice out here. Best way to reach me is email, and I'll leave that with and I'll share with you at the end of the presentation. So Amna, should I start answering questions first, or should I go through this first?
I would like you to go through first and 10 minutes. You can, talk about the topic for next 10, 20 minutes, 15 minutes, and then we can start taking questions.
Sure. So when I was looking at, the topic, women in therapy, are female therapists more empowering for women? I looked at, hey, what are the aspects that, what does data and statistics show? Well, according to the American Psychological Association, females make up 76% of the population within the mental health field. So that's a huge, huge, huge improvement from what it was, 50 or 60 years ago. However, when I look at further data, there's a huge gender gap, a huge disparity between Eastern and Western cultures when it comes to male and female therapists. And I started thinking, why is that? And then, some of the things that I tied into and I looked at, the mental health stigma that is for women. And I looked at specifically, because I work within a predominantly, Caucasian white population, there is a huge disparity when it comes to within Eastern cultures. And I'm not saying when I refer to Eastern cultures, I'm talking about, the Asian cultures. I'm also looking at, the context within from Pakistan, India, Bangladesh, and all the Middle East, the subcontinent. There is a huge disparity of clinicians and how they're seen. Why? Because mental health is not so widely accepted. For the first thing, it's an invisible wound. If you don't see it, it didn't occur. What do you mean by, verbal abuse? What do you mean by, neglect? What do you mean by trauma? Well, I can't see it, so therefore it must not exist. And I see that more prevalent within the Asian culture because it's tied to guilt and shame. Guilt in terms of, you're airing out your dirty laundry if you go to a therapist. And then the shame part comes in, oh my God, I can't handle my family business, or I can't control my outcome. And these are all distortions that an individual has. It negatively impacts within the society. Oh my God, she goes to a clinician or a therapist, there must be something wrong. Now, there is a difference between a psychologist and a psychiatrist, which people don't understand. And it's for those of us who are in the medical field, we understand psychiatrists can prescribe medication. Now the AP has allowed us, some psychologists in some states with further education, be allowed to prescribe, but and Illinois is one of those states. However, I do not, and I'm not one of those clinicians. I kind of stay away from the medication piece, and I do whatever I can in talk therapy to normalize those fears, to normalize that impact within society, that guilt and shame, validate those invisible wounds. And sometimes it shows up in many, many different areas. I see it in domestic violence. I see it in sexual abuse. I see it in marriages, love marriages versus arranged marriages. I see it in gender identity. This is something that I've seen more prevalently come up more in the last, I would say, year, where it's not just Caucasian children that are saying, hey, I don't feel right in my body. And, at that point, I can, as a Muslim, I have to put my beliefs aside. As a clinician, I have to keep them separate. So church and state need to be separate in order for me to think and help. Depends who my audience is and who my client is. And if they ask for that spiritual or that perspective, I will provide it. But otherwise, I keep it pretty straightforward, because I like to include everybody within and give everybody the opportunity to reach out for help. So gender identity has been rampantly shifting. I've had a lot of kids, adults, come out of the closet and say, hey, I don't feel, what I was born as doesn't match with how I feel. And there's a huge shutdown when it comes to, us being Muslims, that, hey, homosexuality is not accepted. Now, my personal stance on it, that's separate. But when I see a client, a child in my office, I have to deal with that. So I'm seeing a change in that. I'm seeing a change in how it impacts some of the issues culturally, religion, motherhood, pregnancy, hormones, depression, anxiety, postpartum, sex and intimacy. I'm seeing a lot of that. Just in education, how does divorce work? So a lot of stuff ties into it. And it's not just, hey, I only see depression and anxiety, or female therapists or just therapists only see that. We tackle a lot of stuff. We tackle, from, like I said, anything under the sun, from social issues to school issues to family issues to anything in between. How do female therapists, myself, come into this play, and why do I think that we female therapists are a better fit? And there are a number of reasons why. Again, there's studies have also shown that females are more empathic. They're less likely to judge and less likely to ostracize or kind of point fingers at, oh no, there is something wrong with you. It's okay, let's talk more. Instead of automatically jumping to a theory and saying, hey, Freud said this, or, Carl Jung said this, or if you come from an Adlerian background or from a humanistic background, this is what theory dictates. I've seen more female clinicians pull things that they need from different ideologies and apply that. There isn't a cookie cutter approach to dealing with all clients. It's what you see in the room and how you treat that. So again, there's more empathic, less judgmental, more relatable, because, it's interesting. In the last year, I've had the opportunity. I had an infant who now is a toddler. So I would see all these mothers come in and say, hey, I'm suffering from postpartum depression and I don't know how to balance this out as well. And little did anybody know I was kind of in the same boat myself. I went back to work 3 weeks after she was born, and it was insane. I did have help and I needed the help, but accepting that help and that guilt that comes with it was a whole lot to deal with. But because of the experience that I had within my own personal self, and I was going through the same thing, it was better for me to relate. I could level with my clients and kind of meet them where they were at. Being a female therapist also brought me into the place where it was more solution focused. It's not, just finding the problem and then finding the root causes. It's also, okay, yes, we've identified a problem. Now, how best do I solve it? So given what I was using in my own life and what was applicable to me, I was able to kind of target these things that I would see from, especially with young moms that were within the field, some, that they were getting married, that were getting divorced. So it kind of brings everything in perspective. So you kind of have your own life going as well, but you have to be careful because there's transference and then there's countertransference as well. So you got to separate that. And, some of that is because of what's going on in my own life, how am I going to treat this patient? You can use, female therapists are more inept to kind of like put those issues aside and then kind of say, all right, this is what's worked for me. This is what theory says. Let's combine some things and see what happens. So in that sense, it worked out, or it works a lot better with female therapists. I've seen, whether it's men or women, there are a lot more comfortable seeking a female therapist than male therapists, unless, there is a cultural or there's a huge gender specific issue that only a male therapist, it's very rare that a male therapist is requested, and it's all across the spectrum. I work with a private practice of 16 women, 16 clinicians from all across the country. Some of us do it remotely, some of us do it in office, and we have 2 male clinicians. And their caseloads are vastly different than ours. So that speaks to itself, the niche of female therapists and the drastic need that's there, especially within our own culture. There is a lack of female therapists that are willing to go out, or being accepted. So there's also that barrier that we deal with within the mental health field is, hey, how do I address cultural things with my own? Because it's very hush hush, but it doesn't mean it doesn't exist. So when I do have somebody of my own culture, of my own religion come to me and say, hey, there's, things I need to do, and I ask, hey, what do you need in this moment from me? And I'm going to put everything aside and let's talk. And I think that allows me the greatest advantage to reach my clients in their darkest moments, to reach them when they desperately need somebody to talk to, whether I show up as a support person, a therapist, somebody who gets them the help that they need, specifically in domestic violence situations, which there are a lot of them going on right now. So when I look at it, given statistics, my own personal experience, what studies show, are female therapists more effective? Absolutely. And I think that number is going to increase. But I think what we need to look at is, the ethnocentric, cultural things that come into play being a female therapist and of the same culture, show up. So my hope through this platform is to reach out to more individuals and say, hey, mental health does exist. Isn't it, religion aside, there's some things that you just need another human to talk to and maybe find the answers yourself. So it's kind of like a balancing and a juggling act. But my hope is that, I reach out to more individuals, and kind of normalize their fears. They're valid. I agree with you. It's scary to talk to somebody and of all a complete stranger, but that individual is going to be judgment free and they're an ally. And I think that shifts things. So that's kind of what I had. And I think if there's specific questions that they are, I'll gladly answer them and then leave you some information about how to find me if somebody needs it.
Right. Aisha is asking that, what are some of the first problematic signs to look out for in children?
So how young are the children? I see young children as young as 18 months forward. So some of the first things you're going to see on a developmental, or are you looking for an emotional? Because I can tell you both. So from a developmental perspective, you're going to look at, are they meeting the developmental milestones, which is, are they sitting, talking, walking, standing age appropriately? Like at those 18-month checkups, at their 12-month checkups, are they meeting those milestones? Are they standing up? Are they sitting down? By age 3, are they verbal? Complete sentences or some sentences. If they're bilingual, there are a lot of cultural things, but I think the number one thing to look for children is changes in behavior off of baseline. And I'm not saying, a 2-year-old isn't going to have a temper tantrum. Yes, they are. I happen to have one right here who's kind of taking everything apart right now. But I think what's important to look at is behavioral changes. Is the child more irritable? Is the child more finicky? Is it organic or inorganic? Are they physically not feeling good, or are they trying to tell you something? Because that's going to show out vastly differently. That shows up as aggression. That shows up as hitting, biting, pushing, shoving other kids. That shows up as, sometimes it shows up as imaginary friends. But if, I'm not saying imaginary friends are not normal. It's very, very much normal for a child to have an imaginary friend. But what are they trying to tell you? The most I've seen when children under the age of 5, when they're distressed, one thing they'll say, when they say, they're always talking. You just got to understand what they're trying to tell you. And children don't know how to regulate emotions. They're too big. These feelings are too big for them. I'm sad. I'm angry. My little one just started to say, Mama, I'm mad. And with all her might, I know she's mad, but I know there's something else going on. Whether she can't change the channel or she wants something that she can't reach, Mama, I'm mad. Or she's not getting her way. Mama, I'm mad. But ultimately, what is that child saying? What does behavior dictate? Are they able to function? So giving them some vocabulary, also aggression, unnecessary aggression, hyperactivity, they cannot sit still. Now, what 2-year-old can sit still? What 5-year-old can sit still, given it's COVID? So I want you to remember that piece too. Is this age appropriate? One of the other things I see with kids, and this is 12 years of experience talking. Anytime, a child says, Mama, come play with me, they're trying to tell you something. Pay attention to your little ones. They're always talking. They're nonstop chatterboxes. They're always telling you something. And often we say, oh my God, you talk too much. Oh my God. Oh my God. Can I just have 2 minutes of silence in the car?
Right.
You have a lot to say. So the first thing you're going to catch on, what did they learn? Ask them about their day. Ask them how school was, how daycare was. How was your night? What would you dream about? And, in times of distress, certain things show up for little kids under the age of 5. For my little one, I know when she's upset, baby aunt shows up. I think I say if you're not that involved in a kid's life, and for X, Y, and Z reasons, I'm no one to judge anybody. Everybody has their own lives and their own stuff going on.
Yeah.
However, when you do get time with your child, try to look at the root cause. When did this behavior change? And that's going to tell you a whole lot. Is it a person that the behavior is more prevalent with? Is it with mom or dad or aunt or uncle or grandparents? Other things I see is, the main thing I see is behaviors. They're more finicky. There's more crying. They're more clingy, or they're completely detached. That's also not a good thing. Secure attachment is something that forms around 9 months of age when they get really clingy and, stranger danger comes into play. So as a mom, yes, there's the mom senses I call, the mom radar that goes, okay, I know my child and this is not right for them. But as an individual, as a teacher, as, an extended family member, you're going to see some intense changes in behavior, whether it's anger, aggression. And for kids that little, sometimes, aggression is the first mark that you see. Throwing things, hitting things, whether they're hitting themselves or someone else, or hitting inanimate objects. That's the first sign you're going to see. There is an emotional piece that's showing up for kids. And at that time, it's good to address that and kind of say, hey, take them aside, maybe spend some extra time with them. But your first thing that you're going to see that I've also seen within practice is behavioral issues show up, whether it's in school. Sometimes, hey, my child is behind in reading and math and they're not doing so well in school. Well, let's think why. Or my child is struggling, playing with other kids. That's a reason why. My child gets very anxious around other kids and they don't want to leave. Like, mira palupa karke, she's holding on and it's like, I don't want to leave you. That also tells you something is going on. So behavioral things are what are going to be looked at: anger, aggression, hostility. Other things that I say, this triangle: bedwetting, hurting animals, fire setting. And this can go across the spectrum from little to the age of 15. If you see that triangle at any time, or you even see one of those things pop up, your radar should be going off. Because that essentially leads to, a different realm, what we talk about, antisocial personality disorder, conduct disorder, oppositional disorder. So if you see bedwetting, if you see fire setting or hurting animals, that is one of the major things if you're looking at extreme behaviors. I don't usually see a whole lot of that unless the kid's in foster homes. That's when I see a prevalence of those kind of behaviors show up. But typically when I see little kids in my office, it's, hey, I'm sad, I don't play well, there's a lot of anxiety, they're aggressive, either they're aggressive or they're hyperactive, or they're very anxious where I can't talk to anybody and oh my God, I'm going to hide behind my mom.
Right.
I can't do that. Those are the things you want to watch out for little kids.
What is the one last tip, like one tip you will give to working mom?
I think the first thing I'm going to say is don't feel guilty. I know as moms, as working women, there's a huge guilt piece. Oh my God, I have to put my kids in daycare so I can make a living. No, there's no guilt or shame. I'm going to empower you as from one woman to another is you are taking care of your child. Essentially, you are doing the best that you can given what you've got. So if that means, your kid you're doing it for them. So again, to take that guilt and stigma piece out and validate, like, I'm not just doing it because I want to, I have to, I need to. Self-care comes into play. You as a mom, yes, you're a mom, you're a wife, you're a mother, you are a whole lot of things, but I think you are a woman first. You're also human. So take some moments to yourself, whether it's 10 minutes in the morning where you do meditation, or it's just sitting on the couch after dropping them off at daycare and kind of like having those 2 minutes of silence to myself, or go get your nails done, when you have a weekend, or something that's for yourself that does not include you taking care of somebody else. I think there's a huge piece where we as moms and we as professionals get stuck in that mode where we only are on the go, 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 go. And what that essentially looks out as is burnout. And that is something, which kind of trickles its own effects. So self-care, whether you go out with a friend or have somebody over or do a Zoom contact, especially when COVID times. I know we're afraid to go out and meet people. So, okay, have the family support, for kids for an hour. If there's have an hour to yourself, even if you're just sitting in the bathtub. And unless sometimes I go, hey, with the two of them, it's kind of like, hey, on some days like today, it's okay if the house is a mess. It's okay if laundry's not there. If it's okay if dishes are there.
Yeah.
It's okay for you to do that. It's okay.